Why do I offer a complete 6-month money-back guarantee on the TM Flow? Hi everyone, I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983, so a good long time. Chronic pain management. And I am the CEO of Dr. J Distribution. And one of the things we distribute, one of the things we use in our office is the TM Flow. It's a great device. So I offer a money-back guarantee because how many times have you purchased a piece of equipment that was overpromised and underdelivered, and it sits down in your basement or in a closet collecting dust after 2 or 3 months? I don't want that to happen to anything that I'm going to sell you. And so you have these salesmen who aren't practicing. I mean, we run an integrated clinic. We have a nurse practitioner, support staff, RNs, LPNs. The LPN does the TM Flow test, and it's the nurse practitioner a few days later, a week later, that will review the test with the patient. So that's how we do it in our clinic. So that's why I offer a complete money-back guarantee. Now, if you're not familiar with the TM Flow, it assesses vascular and neurological components. Here's the Y TM Flow. Sorry for my graphics, but I'm old school. Artery and autonomic nerve function or damage are the most frequent complications of diabetes, kidney disease, hepatitis, hypothyroidism, and aging. Although the symptoms may imitate each other, it's imperative to distinguish between autonomic neuropathy and artery disease because the treatments are quite different. TM Flow allows physicians a better chronic care management and to distinguish between these two. So what you see here is how it's set up. It has the cuffs on the ankles and the arms, pulse ox, electrodes on the feet here. And so here is what is the TM Flow, a medical device data system integrating 3 technologies: galvanic skin response, the pulse ox, as I showed you, and the anchio-brachial indices. So who's it for? Well, anyone with basically diabetes, heart disease, any type of chronic pain, hypothyroidism. So yeah, it's basically for your patient population. We check everyone with the TM Flow. So I believe in it so much. It's helped our clinic so much. You know, in the face of declining reimbursements, the TM Flow helps your clinic get back on track. And I believe in it so much, I give you that 6-month money-back guarantee. There is no other equipment salesperson out there who is making that offer. And you can say, well, how do we know you're going to give us a money-back guarantee? Well, I'm also a distributor for RST Synexus, their Neogen system. I've sold about 300 of those units, and only 6 came back. And I can put you in touch with those docs. I've sold about 50 TM Flow units to date, and I haven't had any come back. So, nothing. So that's why I'm making this offer. So if you're interested, email me. How much is it, you might ask? Well, it's $34,500. That's $700 to $800 a month on a lease. It's a no money down lease. If you don't have the best credit, you know, some docs, unfortunately, I have good friends. They've been through multiple divorces, multiple homes. You know how that goes. We can help you. 6 months, money back, no questions asked, guarantee. This price here through the 31st of December is actually $32,000, so you save $2,500. Again, nobody's offering that money-back guarantee. And most importantly, you know of Section 179 of the IRS tax code, right? You get to write off the entire $32,000 between now and the 31st, now and the next year. It's early. I only do one take when I make these videos. But Section 179, instead of writing off the $700 a month, maybe you purchase it in November, so you write off $1,400. No, you get to write off the complete $32,000. What do we use it for? Again, this is my email, drmlj83@gmail.com. You email me, I'll send you a lease app. We use it for peripheral artery or vascular artery disease, small nerve fiber issues, chronic pain in the extremities, cardiometabolic function. So you're looking at the cardiovascular side, metabolic side like diabetes or insulin resistance, autonomic nervous system, we're checking that function, and endothelial dysfunction. So that's what we're looking at. A lot of doctors want to know, and I'll put my email up again, what are the codes? Well, we use a 93922 systemic nervous system one side, a 93922XS, which is the second side. 95921 is the cardiovagal innervation, the PNS, peripheral nervous system, and 95923 autonomic nervous system function. So, like I said, reimbursements are decreasing. They're going to decrease every year. That's just CMS. And I don't care what political persuasion you are, but I'm making this video in November of 2022. Biden is in office and he's driving down those reimbursements. I don't care what you say. Yeah, how are you supposed to combat high overhead staff that want increased pay because they feel their value is a lot higher? And I'm not saying they're not. I mean, you need to pay people well, and we do. But you're getting squeezed on both ends, right? So we are here to help you. That's what I do. I know the business side of it. I've been doing the business side very successful since 1983. So what are the reimbursements with the TM Flow? Anywhere from $400 to $500. In our office, we have the patient come in. The LPN does the actual test. So you can have an MA do it. And that takes about 20 minutes, 10, 15 minutes. Just depends on how much talking there is. We used to schedule 30. We've got it down to 20 now, and she can actually do it in 10. But so the LPN does the test, and we get $320 reimbursed for that. And then a week later, we have our mid-level, our nurse practitioner. She comes in and goes over everything with the patient. And so that's another $120 to $125, depending on the insurance company. And then on our side, being an integrated clinic, we'll make some recommendations for supplements. The nice thing about the TM Flow, and as you well know as a physician, patients, they want to see those tests. They like testing, and they're going to follow your recommendations. They're going to be more compliant, because compliance is an issue, with that in front of them, looking, saying, I just had a guy yesterday. Let me show you this one. Look at this. 40% cardiometabolic score. I mean, it's very poor. And I mean, he followed the recommendations to the T, and he also has peripheral neuropathy. So we use a couple things with peripheral neuropathy. A shockwave unit, shockwave. We use the Sanuwave. You got to have something more powerful than a radio pulse wave with like Gaines wave or Zimmer or something like that. But yeah, that's what we do in our office. We also use the Synexus Neogen system. So that's why I offer the money back guarantee, so it doesn't end up in a closet collecting dust. If you saw my basement, you just shake your head. 39 years of practice. And, I'm one of those guys. Maybe we'll use it down the road. So it's sitting down in my basement. Again, I'm Dr. Michael Johnson. If you're interested, you'd like to set up an appointment to get on the phone, that's drmlj83@gmail.com. Thanks for taking the time, and I appreciate you. Looking forward to speaking with you in the future.